name is Trina Rose Cereza Fox, and today I'll be performing the skill video of a sterile central line dressing change. I would first start by ensuring I have all my supplies, which I do. I have the sterile dressing kit, mask, gloves, and then the patient. And then I will enter the patient's room, introduce myself, ensure I verify 2 patient identifiers, and I will close the curtain or door for patient privacy and hand hygiene. Then I will put my mask on. And then I will offer the patient a mask, or I will instruct them to turn away from the site. And then I will hand hygiene and put on my clean gloves. Okay, now I will be removing the dressing. I'm going to ensure to use my non-dominant hand to stabilize the catheter line, and I will remove each corner one at a time, straight up and parallel to the skin. One more corner. Okay, and then I will ensure to remove it away from the insertion site, and then I will discard. Now I will make sure I'm inspecting the site. I'm going to inspect the insertion site, the surrounding skin for erythema or any signs of infection, and then I will also check the catheter line for any kinking or obstructions. It looks good, so now I'm going to discard my clean gloves into the trash. Hand hygiene. Now I will open my sterile kit, ensuring sterility by opening it away from me. Okay, and then I will remove the sterile gloves carefully. And then for this, I'm going to ensure I only touch the 1-inch border. Okay, and then I will put on the glove for my non-dominant hand first. My hand's already sweaty. Okay, and then I will use my non-dominant hand to go into the cuff here to put it on my dominant hand. Okay, and then I will grab the chlorhexidine. With the chlorhexidine, I'm going to ensure that I use it in a friction motion back and forth for at least 30 seconds. I'm going to do it on each side of the area, the surface area of where the new dressing will be placed. If I were to use alcohol, I would use a circular motion from the inside, working my way out, ensuring I let it dry. And I will also clean the catheter tubing as well. So I'm going to grab chlorhexidine, and then I will also grab the gauze. I'm going to hold the catheter tubing up. And that's gently. And then in the real world, I would crack this open, ensuring to saturate the sponge with the chlorhexidine. So back and forth motion, friction for 30 seconds on all sides. I would even go here. And then I would do the underside of the tubing and the top side. I would ensure to let that dry. And then I will discard my supplies here. And then I will grab the new dressing. And I will place it just on top. Making sure there's no bubbles and nothing is pooling. This dressing, in the real world, I would use the proper size dressing. This one's a little bit bigger than the skin provided. And then I would use my pen or Sharpie here. I would write my initials, date, and the time. We can discard. And then I will place this on the side of the dressing, ensuring I'm not obstructing any view of the actual site. Once I have that done, I will discard of my supplies in the trash, remove my sterile gloves, remove sterile hand hygiene, remove my mask, trash, patient's mask if they used it, trash, hand hygiene again, make sure my patient is make sure my patient is in a position of comfort, call light within reach, and I'll go document my results. Thank you.